Welcome on my channel, Charming Sign. Today we are going to see the bone that is scapula. So first of all, we have to know about what is scapula. So scapula is a large flat triangular bone that is present at the upper part of the posterior lateral aspect of the thorax. When we are going to talk about the scapula, we have to know that it's having a two surfaces. That one is the first one is the costal surfaces and the second one is the dorsal surfaces. So the costal surface is the that surfaces which lie toward the side of the costal cartilage or toward the side of the rib. This one is the anterior view or the anterior surface is known as the costal surfaces. The dorsal surface is the surface which lies posteriorly to our body that is known as the dorsal surfaces. It's having a three border. That is the one is the superior border, lateral border and the medial border. So as we can see it in a superior view, there's this line, it is the superior border, or if we see in the anterior or the posterior view, this is the superior border that is present on our scapula. Thus another one is the lateral border. We can see it in the lateral view. This is the lateral border of the scapula that lies toward the glenoid cavity. This is the lateral border. When we are going to talk about the medial border, then we see that this one is the medial border, or the medial border is that which lie toward the midline of the body or toward the vertebral column. These are the three borders of the scapula, and when we look at the superior border, as we can see, when we are going to see about the superior border, we will see that the superior border is thin and the shorter near to the root of the coracoid process. This one is the coracoid process. It will be at the near to the root of the coracoid process, and it's having a one precise landmark, that is suprascapular notch, that will lies here. When we are talking, let me draw it. When we talk about the landmark, then we will talk about the suprascapular notch that will present little here. Okay, the lateral border, when we look in onto the lateral border, when we look at another lateral border, we will see that it's having a little thick. We will see if it's this area, it's a little thick area that is present at of the lateral border at the upper end, and it's present having the infraglenoid tubercle. It's having a landmark, that's the infraglenoid tubercle. That is the at that place there is a tubercle present, infraglenoid tubercle at the lateral border. When we look at toward the medial border, this one are the medial border. So this one is the medial border. So when we look toward the medial border, we will find that it is a thin and it extends from the superior angle. This at approx this place, there is having a superior angle will be present. So it's extend from the superior angle to the inferior angle. Inferior angle, this is the place where the inferior angle will lie. It's having a three angles. We talk about the two surfaces, that is the costal surfaces and the second one is the dorsal surfaces. Dorsal surfaces, we talk about the three border, that is the superior border, lateral border. This one is the lateral border, and we talk about the medial border. Okay, now we are going to talk about the, let me remove it. Okay, that's all. We talk about the angles. First let me remove it. Yeah, that's a good one. So when we are going to talk about the angle, it's having a three angles. That is the superior angle, inferior angle, or the lateral angle. When we look onto the superior angle, the superior angle will lie here. If we'll see it in a posterior view, then we will see that the superior angle will lie here. The lateral angle will lie approximately here, and the inferior angle will lie this here. Okay. So when we are going to know about the superior angles, then we have to show that the superior angle is covered with the trapezius muscles. But generally the trapezius muscles insert here. So it's generally covered with the trapezius muscles. Inferior angle, that is when the below one, that is at the inferior side of the scapula. It's generally covered with the latissimus dorsi muscles. And the lateral angle that is present here is broad and bear the glenoid cavity or the fossa. It bear the glenoid cavity or a fossa which directed forward, laterally and slightly upward. So sorry. So these are the things that are present on the surface, that the scapula is having a large flat triangular bone present at the upper part of the posterior lateral aspect of thorax. It having the two surfaces, the costal surfaces, dorsal surfaces. It's having a three border. That one is the superior border, lateral border, and the medial border. It's having a three angle, that is the superior angle, inferior angle, and the lateral angle. And it's also having a three processes. So I'm removing all this. So it's having a three processes. That one is the spinous process, acromion process, and the coracoid process. So when we are talking about the processes, then the spinous process is this one. This one is the spinous process. This one is the acromion process. And if we see it in anterior view, this is the coracoid process. Okay, this one is the spinous process. This one is the acromion one, and this one is the coracoid process. So if we see, the spinous process is a triangular plate. Let me remove the landmark for the spinous process. Yeah, if we see, look into the spinous process of the scapula, then we see that it's a little triangular in shape. Yeah, this is a shape of the spinous process. It's having a three border and the two surfaces. And one of the major thing is that it divides the scapula or the posterior side or the dorsal surface of the scapula into two part. That is the, change it, that is the spinous one. This one is the supraspinous, and the below the spinous process is the infraspinous. So the spinous process is a triangular in shape. It's having a three border two surfaces, and the one of the major role is that it divides the posterior aspect of the or the dorsal aspect of the scapula into the two landmarks, or the into two part. That is, the one supraspinous is the upper part which lies up above from the spinous process, and the inferior one which lie inferior or the lower from the spinous process is known as the infraspinous. If we talk about the acromion process, this one is the structure. This is the acromion one. So when we are seeing the acromion one is having a two border, medial and lateral, two surfaces, and it's having a major is that it's having a facet for a clavicle bone. It's having a one facet that is present for the clavicle bone and form a acromioclavicular joint with the clavicle, with the lateral side of the clavicle. When we look into the coracoid process that is present here, the process is directed forward and slightly laterally. So it's the process when we look into this also, it's lies little forward and laterally. It's slightly laterally, it's bent and finger like projection. This is known as the coracoid process. These are the general features of the scapula. So when we are going to, first of all, we will see the which are the landmarks that is present on the scapula. Then we are going to talk about the which are the muscles are going to attach on the scapula. So when we are going to start, we have we will see that what are the general landmarks for the onto the scapula. It's the anterior aspect, or we will say that it's a costal surfaces. So I'm going to mark all that part with the green. Yeah. So we will start it from the below one. So at the below, if we see the costal surfaces, then this area is known as the cost inferior angle. As we discussed before, that this area is known as the inferior angle. This one is the lateral border, and this one is the medial border of the scapula. This is the place is known as the this is the place that is known as the scapular fossa. This is the place known as the scapular fossa, where the scapulary muscles will going to attach. It's a scapular fossa. This is the glenoid cavity or the glenoid fossa. This is a major landmark I am going to tell about it. There's having a supraglenoid tubercle will be present. As here will be a supraglenoid tubercle is a landmark that is present here, and it's having a one coracoid process. This one is the coracoid process. There's having a acromion process. This one is the acromion process, and this one on the acromion, this is known as the facet for the clavicle on the acromion. This is the superior border of the scapula. That's all the major landmark that is present on the anterior aspect of the scapula. Okay, so if I am going to repeat it again, then there is having a inferior angle, lateral border, medial border, subscapulary fossa, superior border, glenoid cavity or glenoid fossa, coracoid process, supraglenoid tubercle, that is one. This is the here acromion process, and there is having a one facet for the making the acromioclavicular joint for the clavicle facet. That is the major landmark that is present on the scapula on the costal sides. So let me remove it and begin on the next. So let's come on the posterior surfaces or the dorsal surfaces. We will get to know what are the general landmark that is present on the posterior surfaces of the scapula. So we will start it. It's a lateral border, medial border, superior border. These are the major landmarks. There has even a supraspinous process. Supraspinous fossa, infraspinous fossa. That are the major landmark. That are the spinous process, acromion process. There will be, you can see the coracoid process as well, but not completely. There is having a facet for the clavicle. There is having a one notch. This notch is known as the suprascapular notch. This is the part. This this is the part is known as the crest of spine, and there is having a, this tubercle is known as the infraglenoid tubercle. That are the major landmarks which are present on the posterior aspect of the scapula. These are the major landmarks that is present on it. So let's come, we will discuss about the some origin. First we will talk about the what are the muscle that is originating from the anterior aspect of the scapula. Then we will talk about what are the muscle that are inserting on the anterior aspect of the scapula. Then we talk about the ligaments. So this is the anterior aspect. So when we are going to see the muscle, that is the subscapularis. This one is the area which is known as the subscapular fossa. It's having the subscapularis muscles is going to originate from this place. This is the scapular fossa where the subscapularis muscles will originate from here. There is having a place at the inferior part. That is the placement for the omohyoid muscles. Omohyoid muscles will originate from here. So subscapularis muscles rise from medial 2/3 of the subscapular fossa. From the medial 2/3 of the subscapularis fossa. When we are going to talk about the omohyoid muscles, then we will see that it is originating from the here bit of the supraglenoid tubercle. Supraglenoid tubercle is little going to arises from there. When we talk about the another muscles, we will see that at the lateral aspect, the short hand of the biceps or the short head of the biceps brachii and the coracobrachialis is going to originate from this place. At the 10 numbers, the short head of the biceps brachii and the coracobrachialis muscles will originate from here. And for the omohyoid, the inferior, when we are talking about the omohyoid muscles, then the inferior belly of the omohyoid arises from the upper border near the suprascapular notch. This one is the suprascapular notch. So there is having a one muscle originate, that is the inferior belly of the omohyoid muscles will originate from here. when we are going to see about the another thing, yeah, first of all, the coracobrachialis and the sort of the biceps brachii arise from the medial part of the tip of the coracoid process. So this one is the coracoid process and this is the tip of the coracoid process. There from here the short head of the bicep brachii and the coracobrachialis are going to originate. The another origin for the one major muscle is that the triceps brachii or the triceps muscles that is present here. So we're going to talk about the triceps muscles. Then the long head of the triceps muscle is originate or the arises from the infraglenoid tubercle. So there is having a landmark, that is the infraglenoid tubercle, that is for the long head of the trapezius muscles is going to originate from here. This is the normal general muscles which are originating from the costal surfaces. So when we are going to talk about the which are the muscles are going to insert onto the onto the costal surfaces of the scapula. So first of all we see that, let me draw it in a blue, yeah, this one. So this is the place, sorry, it's going to outside of the scapula. So this is the place where the serratus anterior, or we can say that the strong boxer muscles is going to insert here onto the medial border of the costal surfaces. One digitation from the superior angle to the, that is this one is the superior angle. So one digitation, there is a little below from the superior angle to the root of spine, mid to the medial border of the scapula, and five digitation, or we say that the five digit or the 5 centimeter above from the inferior angle, it's get inserted till here the serratus anterior muscles is going to insert on the scapula. The another muscles, that is the pectoralis minor. So when we are seeing it, we have to know that the pectoralis minor is also going to insert onto the medial border and superior surface of the coracoid process. So when this is the landmark, that's the 11th one, this is the pectoralis minor is inserted into the medial border and the superior surface of the coracoid process. These all the muscles where the muscles is going to insert. When we are going to talk about the ligaments, when we are going to talk about the ligament, then there we will say the coracoacromial ligament. The coracoacromial ligament is originate from the facet on the medial aspect of the acromion process. This one is the coracoid process, this one is the acromion process. The ninth one, the acromioclavicular or coracoacromial ligament will attach to the capsule of the acromioclavicular joint. There's having the another coracoclavicular ligament. Coracoid ligaments, it's attached to the lateral border of the coracoid process. It attached to the lateral border of the coracoid process. Lateral border, let me draw it in a green way. So it originates from the lateral border of the coracoid process and the medial side of the tip of the acromion process. When we see the acromion process, then we will see that it's going to originate from the tip of the acromion process. There is having the two more ligament, that is the suprascapular ligament, that is going to attach from here to here, that is the near to the omohyoid bone. That is the normal ligament that are present on the costal surfaces. So when we are going to talk about the posterior aspect of the scapula, so we've discussed about the what are the landmark that is present. So when today we are going to talk about the which are the muscles is going to originate and insert it on the dorsal aspect of the scapula. So we are going to start it from the originate muscles. So first of all I will start from the supraspinous process. This one is the supraspinous fossa, and the supraspinatus muscles is originate from the medial two-thirds of the spine supraspinous fossa, including the upper surfaces of the spine. The another muscles is the infraspinatus, that is originate from the medial two-thirds of the infraspinous fossa, including the lower surface of the spine of the scapula. Sorry, surface of the scapula. There is having a muscle that is deltoid muscles. When we are going to see the crest of the spinous process or the spine of the scapula, then we will see that the deltoids is going to arise from the lower border of the crest of the spine and from the lateral border of the acromion. We will see that there is having a long head of the triceps is going to arise from the, we'll see it in a better view, that the long head of the triceps is going to arise beneath the infraglenoid tubercle, and the teres minor, this one 7th one and this one is the 8th one. This is a teres minor muscles that is arises from the upper two-thirds of the rough strip on the dorsal surface along the lateral border. When we talk about the teres major, then this is the place where the teres major muscles is going to originate from the lower one-third of the rough strip on the dorsal aspect of the lateral border. So these are the complete landmark which are originating from the posterior surface of the, or the dorsal surface of the scapula. There is having a groove. Let me try it with a different one. There is having a present of a groove that is groove for the subscapular or the groove for the subscapular artery present between the origination of the teres minor muscles. So we are going to talk about the insertion of the muscles. So when we are going to talk about the insertions of the muscles, First of all, we talk about the trapezius. So this is the place where the trapezius is going to insert. So the trapezius is inserted onto the upper border of the crest of spine. Upper border of the crest of spine onto the medial border of the acromion. The medial border of the acromion is the place where the trapezius muscles is going to insert. The another muscles is which is going to insert here, it is the levator scapulae. This is the place where the levator scapulae muscles is going to insert. The levator scapula is inserted along the dorsal aspect of the medial border from the superior angle up to the root of the spine. This is the root of the spine and this is the superior border. So from the superior border to the root of the spine, it is going to insert. The another muscle is the rhomboid minor and the rhomboid major muscle. So the rhomboid minor, this one is the rhomboid minor. So beneath the levator scapula, the rhomboid minor is going to insert into the medial border of the, or we say that the opposite to the root of the spine. This is the root of the spine and the complete opposite to the root of the spine. There is having a muscle rhomboid minor is going to insert. This one is the place for the rhomboid major. This is the place for the rhomboid major. So the rhomboid major is inserted into the medial border of between the root of the spine and to the inferior angle. Here the muscles is going to insert. There's having a one origin that I forgot to tell, that is the origin for the latissimus dorsi muscles. This is the origin for the levator scapulae muscles. Let me draw it with the red one. This is the place where the latissimus dorsi muscles is going to originate little amount to the inferior angle of the scapula. When we are going to talk about the ligaments attachment, then we will see that at the suprascapular notch, let me draw it in a black. At the suprascapular notch, there is having a attachment of the suprascapular ligament. At the coracoid process, there is having a coracoacromial ligament. At the end of the lateral end of the acromion process, there is having a coracoclavicular ligament. These are the major ligament that is present on the posterior aspect of the spine. When you will see that the lateral aspect of the scapula, then you will see there is having a little thick border at the upper 2/3 of the scapula. There is having a little thick border, and we will see only the landmarks. We can only see the landmarks on it. That is the first one is the coracoid process. The second one is the supraglenoid tubercle that is present. Third one is the glenoid fossa. Fourth one is the infraglenoid tubercle for the long head of the triceps brachii. Fifth one is the ventral surface of the scapula. Sixth one, acromion processes. Seventh is the acromion angle. Eighth is the lateral border, and ninth one is the inferior angle of the scapula. When we are going to see the superior aspect of the scapula. Then we will see the facet for clavicle. This is the flat facet of clavicle where the clavicle bone is going to make a joint, acromioclavicular joint. The acromion process, the superior border of scapula, spine of the scapula, head, glenoid fossa, neck of scapula, conoid tubercle, conoid tubercle for conoid ligament, the coracoid process, and 10th one is the attachment of the trapezoid ligament. When we are going to talk about the muscles that is going to insert on it, then the same way that we talk, there is having a muscles inserted on this. That's all for the scapula. Thank you so much. In this video we talk about the scapula. There are the landmarks which are present on it. We talk about the muscles which are going to originate from the scapula, muscles which are going to insert on the scapula, and talk about the some ligaments. One thing I forgot to tell you that how we determine the side of the scapula. So when we are going to see the scapula, then we will see that the lateral border, when we talk about the lateral border having a glenoid socket or the glenoid fossa. It's a large fossa that is present onto the lateral border of the scapula. Onto the dorsal surfaces, when we talk about the dorsal surface, this one is the dorsal surfaces. There is having a convex triangular spine, that is the spinous process that is present on the dorsal side of the scapula, and it divides the scapula into the supraspinous fossa and into the infraspinous fossa. That is present under to the lateral border. The lateral border is little thicker than the medial border of the scapula. That's all for the scapula. Thank you very much.